Hello, thank you for looking at the plantar fascia heel pain webinar. The purpose of this webinar then is about 20-25 minutes worth of information about this problem and a number of options you can do to hopefully help reduce the pain. Previous names for plantar heel pain have been plantar fasciitis, heel spur, policeman's heels. You may have had your pain referred to as these, but they all come under the term of plantar fascia heel pain. And it's been put together by the Swansea Bay University Health Board, a group of specialist physios working there, and those are Alison Hill, Andy Lewis, Anthony Byrne, John Challis and Tanya Francis, and also John Neathy and Martin Wright from the Podiatry department have also added to this. The aims then of this webinar: what is plantar heel pain, what are the common causes and symptoms, how is it diagnosed, how we make it better, which is probably what you're most interested in, use of pain medication, plantar heel pain in runners, how often we use x-rays and scans, and a few other useful links at the end which you may find helpful. So what is plantar heel pain? Plantar heel pain is the most common cause of heel pain we see. There are a few others, but the diagnosis for plantar heel pain is really quite easy, and I'll discuss that shortly. The plantar fascia is a fairly broad band which travels from the bottom of your heel bone and moves towards the toes, and it's responsible for a number of important functions in your foot. And when that plantar fascia becomes overloaded or aggravated more than its ability to heal and correct itself, then you develop plantar heel pain. The plantar fascia is a very important structure in the foot, and it's got a number of functions. One of the main ones is, as you stand, the arch on the inside half of your foot is supported by the plantar fascia. It also acts as a shock absorber. So with that arch, when you put weight on your foot, you may notice that your foot flattens ever so slightly, and that is the way the body or the foot can absorb some of the impact from the ground when you're walking or running. It also helps with walking. When you put your foot flat, as your leg comes forward, so your shin comes forward, your calf muscle, your Achilles tendon and your plantar fascia go a little bit tight as they're being stretched, almost like a spring. And then when you lift your heel, that spring releases and propels you forward slightly. So it does really help with the action of walking. There are a number of causes of plantar heel pain. As I've said already, plantar fascia pain or plantar heel pain comes when that fascia is loaded beyond its ability to recover. So it's loaded too aggressively, too suddenly. Common examples are when people rapidly increase the amount of walking or standing or running they're doing. Often this can be an exercise program started too aggressively, often couched to 5Ks. People can pick up a little bit of heel pain. Walking more than normal, for example going on a walking holiday that you're not used to. And standing for long periods. This is often when people start a new job which involves periods of standing, particularly on hard surfaces like working in warehouses or in retail. Also, a sudden change in footwear. So there are certain kind of trainers with very little support. We have seen a number of people who bought these, and then before their foot can get used to that lack of support, they then do a very aggressive training program, and that can bring problems. Also, a rapid increase in body weight. It's not uncommon for women when they're pregnant to develop some heel pain because of the sudden increase in weight. Also, this goes slightly with the increase in walking. Quite often we see people who perhaps eaten a little bit more than they should over Christmas. The New Year's resolution is to try and aggressively lose weight, so they start a training program they're not ready for, and the increase in weight and the increase in running and steps can sometimes give this plantar heel pain. You know, there are a number of risk factors. Jobs that involve a lot of standing or walking, they're quite common with people with plantar heel pain. As I've said, people working in factories and warehouses or standing for long periods in retail. Also police officers and post workers. Because of the sheer distance they cover, they're quite prone to this kind of problem. Being overweight is another risk factor. With more weight pushing through that plantar fascia and straining it, people become more susceptible to developing heel pain. And another one that's seen in the research is tight calf muscles. The symptoms then of plantar heel pain, we would typically expect pain to come on quite gradually. It may worsen over the course of a few hours, days or weeks. A very rapid onset of plantar heel pain is really quite unusual. So for this, the pain will come on instantly and will be very severe all of a sudden. That probably needs to be checked by either a doctor, a physio or a podiatrist. People will typically report a sharp pain under the heel. The picture on the right of the foot, that red area is really typical of plantar heel pain. Quite often when people stand up after being sat for a while, or a very common aggravating factor is the first steps out of bed in the morning. And that pain is very localized and quite sharp and uncomfortable. Often people will report that if they're stood or walking for a few minutes, that pain eases ever so slightly, but may not go altogether. And plantar heel pain is not usually affected with pain throughout the entire heel. Pins and needles, or what we call forefoot pain, so that's the toe half of the foot. Diagnosing plantar heel pain then is really, on the whole, quite easy. It can be diagnosed based on where the pain is felt, and the picture on the previous slide, what eases or worsens the pain. That's quite predictable for plantar heel pain most of the time, and a physiotherapist, podiatrist or doctor may want to just confirm that by pressing on certain parts of the heel to try and reproduce that pain. And plantar heel pain is quite a specific diagnosis. As it is fairly easy to diagnose, there's no benefit in the early stage of x-rays or scans unless we are thinking it's something actually quite different. Treating plantar heel pain is what we're probably most interested in. I certainly want to say that this isn't a question of you coming to somebody and them fixing your heel pain. This is something that you actively need to improve yourself. And there's a series of exercises we'll go through now. There's some information on footwear and insoles and some lifestyle changes. When they don't work, we then sometimes think about physiotherapy and podiatry, and there are some further treatment options beyond that. So common exercises, there have been a number of research studies looking at a few different options. These are probably the three most useful and relevant. So the gastrocnemius stretch, the gastric is the major muscle in your calf, that's all that is. So in this picture, it's the left foot that's affected. He stands with the left foot behind the right, leaning against a wall. The important point here is that left knee is as straight as can be made, and the left heel stays on the floor. By leaning forward then, you'll often feel a good stretch in that calf muscle. Holding it for approximately 30 seconds or so, doing 3 in a row a couple of times a day will be quite helpful. The plantar fascia stretch, this is slightly different. Again, it's the left foot in the picture that's being treated. By lifting the toes up and placing them against the wall, you actually tension the plantar fascia slightly. So with this stretch, you're stretching it very much from both sides. Once those toes are up, again you keep the heel down and you push that left knee forwards as the arrow shows. Again, 3 30-second holds, a couple of times a day is usually enough. Then to strengthen the plantar fascia muscles, the muscles tension in the bottom of the foot, this is one option. So if you lift the toes up onto a towel or a book or something, and again the purpose of that is to tension one end of the plantar fascia, you then do a calf raise, you go up on tiptoes, and that can really strengthen a lot of the muscles in the foot and in the back of the ankle and the calf. Because we're strengthening, doing hundreds of repetitions is not very helpful. Going up over the course of a few seconds and then back down over a few seconds. 3 sets of 12 is usually appropriate to start. If you're finding that quite easy, it's probably worth adding weight to that. So if you've got some dumbbells or a kettlebell, or you can put some weight or books or something in a rucksack, just to make it more difficult so we strengthen those muscles more. And this is usually done on alternate days just to give it a chance to recover. Some additional options. Some people find these things quite helpful. The plantar fascia ice massage. If you place a plastic bottle with water in the freezer, or some people like to use an empty wine or beer or water bottle, glass bottle, that placed in the freezer, when people are in quite a lot of plantar heel pain, whether they've been out walking or come home from a long shift in work standing. Taking that bottle, placing it on the floor, you then rest your foot on top of that bottle as shown. You don't stand on the bottle, but resting that foot on the bottle, rolling it backwards and forwards. People often report quite a soothing massage effect to that. It won't last very long, but it can certainly help settle down that acute flare-up of pain that you may have caused. Gel heel cups, they're another option. Some people find these more helpful than others. They can be bought quite cheaply and easily from Amazon or Boots or places like that. They usually come in a pack of 2. One goes in each shoe, don't double them up. And essentially they just add a bit more shock absorber to your shoes, so it just takes a little bit of the pressure off the plantar fascia. Footwear and insoles is the next slide. So footwear really has quite a large potential to help with your pain with plantar heel pain, plantar fasciitis as it used to be called. You tend to find is the more supportive and cushioning the shoe, then the less pain experience when you're walking, which is when people get most of their problems. The kind of shoes that are very popular tend to be Skechers because they're quite soft, so they can really absorb that impact nicely, or running shoes are also quite popular because they have good arch support and they're especially designed to absorb a lot of that impact for when you're running. So those are quite popular. If for whatever reason you can't change your shoes, you can't wear trainers in work and things like that, then you may be able to help yourself a little with a set of off-the-shelf insoles. One example here is an Ortho-Heel Sport. If you just type that into the search engine, I'm sure you'll be able to find a number of places selling them. The advantage of these, as are many others of this kind, is they've got some good support in that arch. So as I said at the start, one of the things your plantar fascia does is it stops your foot going particularly flat. So if we can take a little bit of the work off it by giving you some arch support, that can be helpful. And if you look at the insole, the pale blue bit under the heel, that adds a little bit of shock absorbing to the shoes you're wearing. There are a number of variations out there on the market, and this is really the specialist area of the podiatry department and their podiatrist. There's a phone number later on in the slides of where you can self-refer to the podiatry department for further advice. But often a set of insoles or some good supportive trainers or footwear can really take the burden off this plantar heel pain. It's worth avoiding if you can flip-flops. What tends to happen there is you grip them with the toes. That puts more work on the muscles in the underside of your foot, and that can often cause more pain. The ones in the middle then are what they call minimalist trainers. There's very little support there. There are pros and cons to those trainers, but certainly not to be encouraged if you're in plantar heel pain. And the kind of ballet pumps on the right there at the bottom, there's no support there at all. And people often find that walking around barefoot, particularly on hard surfaces, kitchen floors, things like that, really do aggravate their pain with this problem. Lifestyle changes. If you are overweight, weight loss is a good way to reduce the pressure on the plantar fascia, and if you reduce the pressure, you will tend to reduce the pain as well. There's a really good link, a really good website on the NHS Live Well site, and there's a link there. There's information on if you are a healthy weight, if you could benefit from losing weight and sensible ways to do that. Reducing or stopping smoking is quite important if you can. Smoking is known to reduce the blood supply, particularly to soft tissues, and by doing that, it takes longer for soft tissues to heal. And as the plantar fascia is a soft tissue, smoking certainly doesn't help your recovery on that. And again, there's a link to the Live Well NHS page on quitting smoking. It's also worth mentioning the pattern of a boom and bust, and this tends to be quite bad for plantar fascia pain. So this is where you rest your foot all day or for long periods of the day, and then cram as much walking or exercise or activity in a small space of time, and that can often give you a real aggravation of your plantar heel pain. So pacing becomes quite useful in those cases. On then to physiotherapy and podiatry. We often find that the majority of plantar heel pain is quite successfully and completely treated by following the previous advice. Now that's the exercises, and expect the exercises to take a few months to do their job. We're doing them for a week or so, we wouldn't expect that to do much. So doing those for several months, looking at your footwear, possibly insoles, the lifestyle, information on the previous slide. If those haven't worked, then it's quite sensible then to self-refer to the physiotherapy and podiatry department. There's information on how to do that later. One of the real advantages is you then get a chance to ask quite an experienced specialist on any questions you may have about your plantar heel pain. There's a number of options that we have available to us. So we may want to strengthen key muscles. Particularly in runners, we find that there are muscle imbalances, and instead of the muscles generating the force or taking the impact quite evenly, they don't do that so much, and you end up putting more pressure on the foot or around the ankle. So strengthening those muscles can be quite helpful. The podiatrists are excellent at checking what's called your biomechanics, so how you're loading your feet. For example, if you're putting more pressure on the inner half of your foot where plantar fascia is most loaded, then possibly correcting that with an insole may be very helpful and take pressure off. There's reasonable evidence to say that using tape can be very helpful for plantar heel pain. What tends to happen is you put the tape on and it lasts for a few days, and it can be really helpful for those few days, but it doesn't really change the long-term outcome. So it's more seen as a kind of rescue, or if you know you're going to be on your feet for a while and there's nothing you can really do about it, like work for example, then tape can be quite a helpful option. Occasionally manual therapy is indicated. So if your foot can't function normally because of some joint stiffnesses, or your muscle control isn't very good, or you have an awful lot of tightness in some of the soft tissue in the muscles, then sometimes a short period of fairly focused manual therapy can help there. But these are very much additions to the options you should have already explored, and it's the exercises that make the biggest difference, and these things are more additions to that, and the lifestyle and the footwear. Further treatment options then. So if you've tried the exercises, if you need to make lifestyle changes, they've been done. You've had a look at your footwear, you're not following a boom and bust approach. Where appropriate and where possible, you're pacing as much as is reasonable. And you've been through physio and podiatry, and in the rare occasion that you're still having pain, there are further options. One of them is shockwave therapy, another is a cortisone injection. These shouldn't really ever be first line treatments. So shockwave, the way that works is that blue and black device there is pressed up against the foot. It causes an impact, and that generates a shockwave that goes into the plantar fascia. It's fairly painful to have done. The pressure of the impact going up that tube, the air pressure is about the same as your car tyre, and it lasts about 4 minutes. We do once a week for 3 weeks, and when all the other biomechanics have been corrected, all the muscle balance work has been done, the joints are moving nicely, and you're still having pain, this can be quite a successful option. A cortisone injection, this is more of a quick fix, whereas the shockwave may take a few weeks to really take effect. The cortisone is really quite rapid. It is a painful injection to have done. Typically, people get almost complete relief of their symptoms from anything from 2 to 6 months. Repeated injections are quite a bad thing and to be discouraged. The more injections you have, the more you put yourself at risk of a plantar fascia rupture, and that becomes quite difficult to treat then. As I say, cortisone injections do have their place. It's certainly not first-line treatment, and we tend to reserve that for people who are in real considerable pain and have tried the other options. Moving on then to pain medication. It's always worth, before taking any new medication, to discuss that with a pharmacist or a doctor just to make sure that they're okay for you to take. The simple pain relief, the over-the-counter kind of products that you can buy in the supermarket, you're likely to get a fairly short-term effect, a matter of a few hours probably, where that pain will decrease. It's unlikely the pain will go altogether. What you may find is for a few hours the pain goes down to about half of what you were experiencing before the medication. That will then wear off and you'll be in pretty much the same position. As that reason, they shouldn't be used as a long-term option. There's a number of reasons for that. We also don't think that taking the painkillers will really change what's going on inside your plantar fascia long-term. There is some research to suggest that an anti-inflammatory can be particularly helpful for these problems. But again, we'll discuss that with your pharmacist or your doctor. And it's certainly not to be used as an alternative treatment to the exercises, the weight loss, and the insoles and physiopodiatry. Painkillers on their own are very unlikely to resolve your problem. They may, as I say, for a short period of time reduce the pain so it's more tolerable. But if in doubt, definitely discuss that with a pharmacist or a doctor. Runners then with plantar heel pain. This is a group that I think deserves special mention. Plantar heel pain is the third most common running injury. Although most runners would tend to be of a lower weight than members of the general public, their feet are subject to much higher loading rates, so they hit the ground harder and faster and more often and in a very repetitive pattern. So because of those differences, they are quite prone to this kind of problem. It usually follows a training error, so starting very aggressively with some speed work, suddenly increasing the mileage, or starting a new program either from scratch or after a long rest. I would discourage you from trying to run through the pain. The reason for that is because it's an overload injury, the more you run on it, the more you're likely to aggravate it. Because running takes quite a lot of muscular effort, what happens then is if your foot can't function properly, you then have to offload some of the force onto another area. So common examples are people will start with plantar heel pain on one side and quite quickly develop it on the other. Also pain in other areas, the knee, shins, things like that, as people are subconsciously changing their running style to deal with that pain. Another question comes up then is, are you experiencing pain only when you run, or do you have it worse when you run and you also experience when you're walking? In those cases, if you only experience pain when you run, it's probably worth reducing your weekly mileage by about half in the first instance, and keep reducing it gradually until you don't get the pain when you run or immediately afterwards. When you're in that position for a couple of weeks, then you can probably start adding in your mileage slowly. If you get pain when you're walking around the house and things, then you probably should consider leaving running for a period. You're able to cross-train, so bike, swimming, rower in the gym, things like that. They put very, very little pressure on your plantar fascia and it can allow you to stay fit while your foot is recovering. There is some sense in having your running technique checked. Speak to a coach about that or someone in a local running club. By changing your foot strike, and runners will be more aware of that than others, what we know is that a very forefoot striking pattern, tiptoe running, puts a lot more pressure on your calf and your plantar fascia, and more of a flat-footed or mid-foot or heel strike can take a lot of that pressure and share it more evenly around the leg. That may predispose you to other problems, but if you are experiencing plantar heel pain and you will insist on continuing to run, then having someone to look at your technique, slightly trying to move to a more rear foot or mid-foot strike can be quite helpful for that. There's a really excellent website that I can strongly recommend. It's by a physio called Tom Goon. He is referred to as the running physio and the link is there. There's lots of information there, not just about plantar heel pain in running, but a lot of other problems that runners tend to experience because of the high workload they go through. I definitely recommend that website. For runners, I would suggest if you haven't improved with reducing the load, having a look at your technique, then I would definitely consider contacting the physio and podiatry department. Imaging for plantar heel pain, it's something we're often asked. Do you need an x-ray? Do you need a scan? As plantar heel pain is usually pretty easy to diagnose, we only really use the imaging if we're unsure about the diagnosis and want to confirm or exclude other problems, or if after several months of appropriate treatment the person still fails to improve their plantar heel pain. And by several months we would expect a couple of months of the exercises, a couple of months at least of physiotherapy and podiatry, trying those insoles or the exercises given before we would expect it to improve. An ultrasound scan is usually the most useful for plantar heel pain. It gives us good detail. X-rays are rarely helpful, and an MRI scan is not usually necessary. Problem with an X-ray is you can often see what's called a heel spur, but that may not relate to the amount of pain you're in. Finally then, there's some useful links. The Swansea Bay Physiotherapy website, which may be where you access this from. There's a lot of information on there. Self-referral to the podiatry department, there's a phone number there. Self-referral to the physio department, also a number. Those links again then to the NHS Live Well sites, the weight loss and quitting smoking, and the running physio website. I'd recommend all of them. If you are still having problems and you tried all those options with your plantar heel pain yourself, certainly get in touch with us and we'll hopefully answer your questions and see what we can do to help. Thank you.